So generally, there's at least 5 drugs in each baby's body.
Barbara Drennen started helping drug-affected babies more than 50 years ago as a foster mom.
And this baby's in the throes of withdrawal, and he's withdrawing from fentanyl and methamphetamines.
In 1990, she founded Kent's Pediatric Interim Care Center, or PICC. The 24/7 nursery was the first of its kind, caring for newborns withdrawing from drugs.
So what does that look like?
Well, you know, what we're seeing is he can't eat, so we have to work pretty hard.
Until recently, infants born with illegal drugs in their system were sent to either foster care or PICC. That's changed.
All these rooms were filled at one time.
Since opening, PICC's cribs were full, caring for up to 20 babies at once.
And now,
Today, not so much.
On the day we visited, there were 3 babies total.
We know there's babies out there that need to be here that are not here.
The number of babies coming to PICC started dropping off in 2021.
Senate Bill 5811.
As a new state law was put into practice, the Keeping Families Together Act makes it harder to remove children from their families, even if a baby is born affected by drugs like fentanyl. Not only were fewer babies filling cribs at PICC, but the number of children in foster care went down. As that number plummeted in the last 3 years, down 28%, in November, King 5 exposed the number of deaths and near deaths went up 114%. And more babies are dying than children in any other age group. In 2023, 67% of children in the state system who died were infants 0 to 12 months old.
It's horrible. It is horrible. And unfortunately, the children don't have any rights.
It's not only child welfare advocates who say these babies need to be at PICC.
This is Georgie.
Parents like Megan Estigoy say this is exactly where her son needs to be. Georgie was born with fentanyl in his system.
do you think that he should have gone home with you guys?
Honestly, when it comes back to his symptoms and withdrawals, I personally am not trained to do that. But I know for sure here that he would have people that are trained to know what's going on and what he's going through.
Parents are taught how to connect with their infants so they can eventually bring them home.
I wish there was more time with him I could have.
Megan wants to be reunited with her son and is in a recovery program, but she says it's not the drug use holding her back. She's been homeless for years and says that is her biggest barrier.
Not being able to find housing. That way I could take him home.
If Georgie can't be with her, Megan wanted her son to go somewhere trusted, a place she knew firsthand is a lifesaver.
Yes, I was here back in January 1991.
30 years ago, when PICC opened, Megan was one of the first babies in the door.
I feel happy that he's here, that his withdrawals didn't take him from me.
Over the last 3 months, the King 5 investigators have shown the outcry against the state law that makes it harder for CPS to put babies and children in foster care. From prosecutors to foster parents, people are calling for change.
And this is not okay. We have got to get these laws changed and get back on track.
Now the people on the ground, social workers, are weighing in.
It feels awful.
Jeanette Obelts is a supervisor with the Department of Children and Youth Services, or DCYF, and a union representative. She says legislators need to listen to them. Social workers should get more support and have a say when it comes to child safety.
Caseworkers are leaving, and they're leaving because they feel like they can't do their job.
Get you dressed again.
Every time a child dies or nearly dies under the suspicion of abuse or neglect, by law, DCYF must conduct a child fatality review and report the results within 6 months. The problem has gotten so bad, we found DCYF can't keep up with the investigations, a violation of state law.
If your hands are tied, if the legislature is telling you how to keep children safe, what is happening?
We're going to continue to see children die.
It's another reason Barbara wonders, in the midst of a fentanyl epidemic, where are the babies?
Everybody wants to protect the children, but that isn't what's happening today.
DCYF is requesting more money to hire employees to keep up with these death reviews. They're also telling us they don't think the state law is to blame for the increase in deaths. They blame everything on the drug epidemic. Over a dozen experts we've interviewed disagree. In the newsroom, I'm Kristen Goodwillie,
King 5 News.
This is the third story in Kristen's series, The Cost of Keeping Families Together. To revisit the first two, text the keyword cost to 206-448-4545 and we will send you that link.